So the cool thing too is remembering that what the person, like Nicole saying that, is her assuming that because she had whiplash and she had some head symptoms, that it's the problems in her head. But that is not necessarily true. We have to ask her body what is true. Because whiplash, though it's most commonly associated with neck things, like in the society makes us think whiplash equals neck.
Yeah.
Whiplash affects everything that attaches to the spine because it is a force of motion that goes through the whole thing like a whip. So even like the cardiac ligaments, the liver ligaments, the ligament that goes around the esophagus and the stomach, like all of that can be affected in a whiplash, causing symptoms in the neck because of the relationship to the nerve, the phrenic nerve and the vagus nerve. To those are the sensory components from those organs to, and guess where they go? To the neck. And also, let's say it was her liver and her body's protecting her liver's on the right side, so we probably see a right side bending pattern. But we can't walk around in right side bending. What does our neck do to accommodate? It does this. Could it be possible that her neck starts hurting because of a right side bending pattern around her liver? Absolutely. So that's why it's like
So
you
simple when
can't
you
get
think
distracted. You can't get distracted by people's stories and their histories.
Mhm.
Their body, your body records your entire history. Anything that has ever happened to you, physically, emotionally, it is stored in your body. So our job as the practitioner is to listen to that and
I think I
trust that more than anything.
think I remember you saying like you often don't even ask them what they're seeing you for first. You just try to do
Yes.
assessment and then get into
Yes.
it.
Yes. What does matter is sometimes people want to feel like they're being heard because, especially if you get good at this work, you'll start getting patients that are like the difficult patients, and they've probably seen like 5 to 10 other providers and not gotten help. And also felt like they were not listened to and felt like they were, well, yeah, not listened to, and their symptoms didn't matter because the practitioner who is the expert couldn't get them better. And so that expert makes them start feeling bad. They accuse them of not doing the exercises or not taking care of themselves or being stressed out, right? They put it back on the patient as their fault. So sometimes patients want to verbally have like verbal diarrhea of their whole backstory. And even though I don't care about it in a sense, because their body's going to tell me where to go, as someone who is trying to make them feel safe, it's important for them to feel like they're being listened to. So if before I can even tell somebody, hey, I would like an unbiased assessment before we talk, sometimes I say that, hey, if possible, I want to hear your story, but I want to have your body tell it to me first, and then we'll have a conversation. But if you can't even get those words out before they're like, okay, I've had this and this and this and that, like just sit there and nod your head and listen and be like, I hear you. It sounds like your back's hurting and this is frustrating and it's been a long time. And let's see what your body has. That's what I say. Let's see what your body has to say. So I don't want you to think their story doesn't matter, because psychologically their story matters very much in order to make them feel safe. But their story doesn't matter in terms of where it is. The goal of the practitioner is to not be like manipulated by their story and led on a different path. That's the hardest part, is hearing
Yeah.
someone's whole history and not letting it bias your actual assessment.
I think I have trouble with that, like
Every
100%.
it's the nature of the beast, right? Because we're taught traditionally to be like, as soon as somebody's like, I hit my head, you're like thinking of all the things that could go wrong because of their TBI or their neck, or right. And so you're thinking about the movement dysfunctions you'll see and the special tests that might be coming up. So that's been ingrained in us for a long time. So it's this, we're learning something new that we need to, yes, of course, it's helpful to have that information in our head, and you will pull from it when you need to. But before you pull from that, you better be asking the body where to start,
Yeah.
because it might lead you to an old ankle sprain from 20 years ago. And now you actually have to pull out all the ankle things to evaluate them, not the neck thing. If they're coming in for neck pain, you're going to have to do both, all the ankle stuff and all the neck stuff, potentially. Is that like a little more clear of how, what I mean by not
Yeah.
biasing yourself?
Yeah.
Yeah. Their story is still important because safety is ultimately the most important thing for them for our treatment session. But at the end of the day, where the body leads me and more is more important. But I do make time for them where they hurt. So if they come in with wrist pain, but their body leads me to their colon and their lower extremity, I treat that, but I make sure I save at least 5 or 10 minutes at the end to do something with their wrist, or else they're not going to think I listened to them.
Yeah.
Even though they probably won't need it.